I'd like to begin by thanking all of you for coming and thanking the Ford School for providing this opportunity to have this conversation. This event is part of the Ford Policy Union, an ongoing series of discussions, occasional debates on contentious issues. Today we're going to talk about drugs, illicit drugs, not the legal kind. And some of you might think, well, that's kind of a strange topic for an international policy center to sponsor a conversation on. But it turns out that the current move or wave or thinking about decriminalization, and in some cases, the state of Colorado, state of Washington, the legalization of some previously in those states, illicit drugs actually has enormous international implications for U.S. foreign policy. We're going to come back to this in our questions session, but to sort of preview this, the United States is party to a number of international treaties, in large part that were negotiated at the behest of the United States, and that have a long history going way back. Under these treaties, and importantly, from at least an academic perspective, we're going to find out from a policy perspective, under the United States Constitution, treaty law, once enacted in domestic legislation, takes precedent over state law. And so we actually have a pretty interesting conundrum on our hands from an international policy perspective. So, with no further ado, let me explain a little bit about how we're going to proceed today. We have our two guests here that, as you may have guessed, have a slightly different take on these sorts of issues than one another. And what I'm going to do is I'll introduce them. Each of them will make a few introductory remarks, sort of laying out their worldview on these types of issues. And then we're going to begin posing questions. I'll start off while you guys are thinking up the best questions you can to provoke them into an interesting dialogue. I have three questions that I have laid out here to begin with that they're aware of, so they've had a chance to think about them a little bit. And then we're going to turn over to taking questions from you folks out there in the audience. Now, you can either write out your question on a card and have it passed forward to me, and then I'll pose the question to our guests. Or we also have an able-bodied assistant here that will bring around a microphone to you if you care to pose your question yourself. Okay? So with no further ado, we're going to begin with Kevin Sabet. Kevin Sabet's the director of the Drug Policy Institute at the University of Florida, and he's assistant professor in the College of Medicine and Department of Psychiatry there. As a Marshall Scholar, way back, a few years back, he received his PhD and Master's in Social Policy at Oxford University, and he has his Bachelor's in Political Science from Berkeley. As a policy consultant, his current clients include the United Nations, where he holds a senior advisory position at the Italy-based UN Interregional Crime and Justice Research Institute. From 2009 to 2011, he served in the Obama administration as a senior advisor at the White House Office of National Drug Control Policy, where he previously worked in 2000 and again from 2003 to 4, serving in both the Clinton and Bush administrations, respectively. Dr. Sabet is also a staff columnist at thefix.com, for those of you that are into the interwebs, and a regular contributor to opinion editorial pages worldwide, including the Washington Post, the New York Times, and the Huffington Post. He's published widely in peer-reviewed academic journals as well as more popular press. So, Dr. Sabet.
Well, thanks. Thank you so much, Alan, for having me, and thanks for everybody for coming and spending the afternoon with us to have this discussion. I want to, of course, thank the Ford School as well, and Mel Levitsky and Don Green and others. You have a wonderful faculty and an incredible policy program here, and it's sort of unique in some of the focus on drug policy, which I think is wonderful. And of course, Jeff, thanks for joining me for this discussion. I'll just lay out, I guess, a couple of minutes, sort of my perspective on this. I mean, you all know, and most of you here probably are studying policy, that all public policies have pros and cons, right? So the question is figuring out what if the pros outweigh the cons of a particular policy. And I happen to think that legalization would, the cons would definitely outweigh the pros. Let's look at sort of current policy right now with illegal drugs. We know that about 8% of Americans are regularly using illicit drugs. 95% of that is marijuana, right? So it's a very small percentage are the other illicits. We know that compared to our legal drugs, that is very, very low. In fact, 27% of Americans, that's more than 1 in 4, still use tobacco products regularly. Okay, that's after every single anti-tobacco campaign you could ever imagine. And over 55% of Americans regularly drink. Clearly, alcohol and tobacco as our legal drugs are normalized, are embedded in our culture, and we pay a price for that legalization. Frankly, 600,000 people a year die because of alcohol and tobacco. We have some of the world's lowest alcohol prices and alcohol taxes in the world because of a lobby that I can tell you from firsthand experience. Any time that we tried to intervene at ONDCP on alcohol policy, we got a knock from the folks there at K Street, the lobbying groups. So our illicit drugs, our legal drugs, really we carry an enormous burden for the right that I think most of us would agree, and I don't agree with alcohol or tobacco prohibition, that really our rights for using those are steeped into cultural norms and probably outweigh the significant cons, though, that there are. From those two legal drugs. I also look at legal pharmaceutical drugs, where you pretty much have to have $1 million education to be able to prescribe a substance. And I see that now prescription drugs are responsible, or the leading cause in this country of accidental deaths. They last year overcame motor vehicle accidents, which is an enormous statistic. It's unbelievable, actually, that would be the case. More than 30,000 drug abuse poisonings. It well eclipses the cocaine and heroin epidemics of the 70s and 80s. So when I look at our legal drugs, and I look at the fact that we have companies out there basically making money off of addiction. You all know Pareto's rule, right? So 80% of the consumption, for example, of alcohol and 80% of the harm is done by the 20% of the users, okay? So it's not, the vast majority of people who drink alcohol, for example, do so responsibly. It only takes the 20% to cause all the great harms, and some of them I just mentioned to you. So what I worry about is modeling our illicit drug policy, which frankly has kept drug use relatively low compared to legal drugs. I worry about wanting to model alcohol and tobacco, wanting to model those drugs after alcohol and tobacco. Now, that is not to say that there are not cons of current policy. Heroin and cannabis in particular are more pure and cheaper than they were 30 years ago. Not this case with cocaine, by the way. There's been a 40% reduction in cocaine use and a 60% increase in price in the last 10 years as countries like Colombia have really benefited, actually, from security type of pro-security policies that the U.S., frankly, helped to integrate. In fact, Don Bureen here, working with Barry McCaffrey 12 years ago, can take a lot of the credit for pushing Colombia in that way, which frankly has made Colombia a destination now, as opposed to somewhere you'd want to avoid. So I think that we have to remember that we do have some successes. But again, I think we can all agree that America's incarceration rate is not something to be proud of. We have 5 times as many people in prison than our historical average, as well as 5 times more than any OECD country average. I'm not proud of that. I don't think that is something that we should be hanging our hat on. But frankly, I think there are numerous kinds of strategies that we can really bring to scale to both reduce incarceration and the negative aspects of having a black market. And of course there are negative aspects of that, while not opening the floodgates and replacing one problem with another, which I think would occur if we legalized current illicit substance. I think we'd have a public health crisis on our hands that would be very difficult to put out. And there's a reason why the American Medical Association and really every single medical association in the country is against marijuana legalization in particular, and I know we're talking about all drugs. But that's because today's cannabis, for example, is not the marijuana that maybe many of our parents, and I'm going to lump myself in your age group if that's okay. Sorry, Ellen, smoked, 30 some years ago, right? It's 6 to 10 times stronger, depending on the year. And we know that whether it's emergency room admissions or the link to mental illness, I mean, if you talk to folks working in the mental illness field, whether it's the professionals or the practitioners, there's absolutely no doubt about the connection with regular cannabis use and, for example, mental illness. Again, 80-20 rule still applies, right? That isn't to say that everybody who uses marijuana, in fact, the vast majority of people use it without a problem and don't need treatment and don't have an issue. But when you have a small percentage that do have a problem, we pay a great cost. So I worry about legalization expanding that. So, I think we're going to get into the international implications in a minute. I think, though, it's going to be very difficult for us on the international sphere to talk about, frankly, any international drug policy. That we're talking about wanting to go to a country with, in the Middle East and have organized strikes against a regime that we don't like under international law, and then under the same breath say, but by the way, we're going to be allowing Colorado and Washington to go forward with something. That puts us in a very awkward diplomatic position, not only policy position. I was just in Mexico City, where the socialist leader of the DF, Mexico City DF local government, who's very much against marijuana, which is very interesting, asked me basically, so Kevin, are you now, basically Colorado and Washington, are they going to be safe harbor for people that we consider criminals? That was his first question I couldn't answer. The second question I couldn't answer was, who are you as a country to tell us to reduce the supply of drugs like heroin, cocaine, and marijuana, of which they are chiefly supplying now, when you are increasing demand? I mean, what authority do you have to say that? So I just think it, for a lot of reasons, puts us in a very, very awkward position. Current policy is not perfect, but I think we can make it better without really opening the door to what is essentially going to be the tobacco industry of our time. Okay, and it's not scaremongering by saying that. We actually have evidence that there's interest. We have evidence that now the tobacco companies are very interested in what's going on. You look at the marijuana companies that are starting up, and they resemble almost to the T the strategies that the tobacco industry used 100 years ago to begin their 100-year, basically, war on public health, which they did. Denying science, funding their own science, questioning anything that comes out that's negative. We're going to be going through that all over again if we are to allow really cannabis or any other drug legalization.
Thank you very much. Our next speaker and participant is Jeff Miron, who is a senior lecturer and director of undergraduate studies in the Department of Economics at Harvard University, as well as a senior fellow at the Cato Institute. He graduated Phi Beta Kappa from Swarthmore and received his PhD in economics from the Massachusetts Institute of Technology. His field of expertise is the economics of libertarianism. He's advocated for many libertarian policies, including legalizing all drugs and allowing failing banks to go bankrupt. He's an ongoing research associate of the National Bureau of Economic Research. He's a past committee member of the National Academy of Sciences Committee on Drug Use in the Workplace. He's written 4 books, most notably for our purposes here, is Drug War Crimes, The Consequences of Prohibition. Dr. Miron.
Thank you. So let me add my thanks to Ford School, to Alan, to Kevin for and the economics department on George Hall. Still root for the Tigers, although it's a bit of a puzzle right now because my son roots for the Red Sox, but still have lots of warm feelings about the area. So my position is that all drugs should be legal. Okay? They should be legal the same way that Starbucks espresso is legal, that toaster ovens are legal, that toothpaste is legal. None of this fancy schmancy, specialized, complicated, artfully designed, specialized market. It should just be legal. Okay? So why? I think the question actually should be, why not? In a free society, the presumption should be, if we believe any of the words that are in the Declaration of Independence or the Constitution or the things that we teach kids in first grade history and social studies and all that, the presumption has to be that people get to do whatever they want to do, whether it hurts themselves or not, unless they are in some significant and hard to avoid way harming other people. And I think the vast majority of people, US and most other countries, accept that for the vast majority of goods. We don't try to keep people from bungee jumping. We might think they're crazy, but we don't have any laws that prevent them from bungee jumping. We let people eat as many pints or quarts or gallons of Ben & Jerry's as they want. We let people engage in all sorts of risky behavior. We let people be free to make mistakes or not, according to their views, rather than imposing that certain things are bad, that we decide certain things are bad and individuals are not supposed to be able to use them. So I think the question should be, is there some convincing, some really strong reason to think that the negative spillovers from drugs are significantly worse than those from all sorts of other activities which are legal? And I think the answer is no. Now, to phrase it differently, let's say you did take the position that government should try to stop activities which might cause people to harm themselves. And of course, some people harm themselves with their drug use, just as they do with zillions of other things. or you took the view that its government's position should be in a position of trying to reduce what economists call externalities, preventing people from doing things which sometimes harm others, such as driving under the influence of alcohol, or putting pollution in the air when you in the water when you run your washing machine, or in the air when you drive your car. Okay, economists are all on board in principle with the notion that policy can be used to try to reduce those negative spillovers, what we call externalities. So there may be a case for some policies that attempt to reduce drug use relative to what it would be in a completely free market. Okay? But if that's your objective, and I think there's good reasons to be somewhat cautious about that objective, but if that's your objective, in my view, prohibition is the worst possible policy you could use to try to reduce the negative spillovers, the negative externalities from drug use, or to try to help those people who are going to harm themselves with their drug use from so doing. So why? First, the evidence is very, very consistent. Prohibitions seem to have small, in some cases vanishingly small effects in reducing use. Dr. Sabet has said people use marijuana less than they use other things that are legal. There's no reason to conclude that's because of the difference in legal status, and every reason to think it has to do with different tastes for different products. Lots of people don't like rum raisin ice cream. The fact that it's legal doesn't have anything to do with that. It's the fact that people just don't like it. And the same is almost certainly true, okay, of the currently illegal drugs. Okay? So we are not accomplishing the stated objective of reducing drug use to any significant degree by prohibiting it. Okay? Second, in the process of using prohibition as a way to reduce drug use, we're having enormous ancillary costs. Crime, corruption, reduced quality control of those drugs that are sold so that many people who consume them harm themselves much more than they would in a legal market, where they at least knew what dosage they were getting. We're generating violence and corruption in Latin America by forcing our view about drugs on countries that are suppliers of drugs, as Kevin mentioned. Okay? We are infringing on civil liberties. We're fostering racial profiling. We're spending non-trivial amounts of taxpayer resources. We're generating enormous negatives by trying to reduce drug use with prohibition, if instead we took the view that drugs should be legal commodities and we use some combination of subsidizing treatment, moderate sin taxes, mild, moderate age restrictions, and things like that. Exactly the kinds of policies that currently exist for tobacco and alcohol. There's just no plausible reading of the evidence that doesn't say that would be a much, much better balance between the costs and benefits of the policy.
Thank you very much. So I'm going to start off with a question then for Jeff. So should we just conclude that the war on drugs has been an utter failure and that there's little to be gained from that?
Well, I guess it's pretty obvious what my answer is to that. So I think the answer to that is yes. I don't think you can point to any convincing evidence that the drug war has reduced drug use. Now, I should say that that's a slightly awkward thing for an economist to say, because, of course, standard economic reasoning says that prohibition ought to have some impact in reducing drug use. It should shift the demand curve in, okay, by imposing penalties for being caught in possession of drugs and things like that, and it should shift the supply curve up by raising the cost of supplying drugs. So standard Ec 101 would predict that you should get some reduction in use, okay, from prohibition. Okay? It doesn't necessarily mean you get more than you would from a sin tax, but you certainly ought to get some reduction from prohibition. But the evidence doesn't confirm that. So that might be because, okay, there is an effect, but it's a really small effect. And certainly you can find evidence for some small effect of prohibition in some circumstances, such as alcohol prohibition in the US. Or it might mean there's something not quite right about our economic analysis, that it's not fully capturing everything that goes on. Or it might mean that the ability of law enforcement to effectively raise the cost of supplying drugs is actually really small. They're just not very good at it. The traffickers are better at evading the police, and the police are at raising the cost of the traffickers. So again, we don't see much of that effect. But if we're not reducing use much, okay, and everyone, including Kevin, agrees that we are having some negative effects, I think they're much bigger, okay, but some negative effects from the policy of prohibition, it just can't possibly make any sense.
So just to follow up here a little bit, so the flip side of your position then, your empirical claim, should be then that legalization of marijuana in Washington and Colorado shouldn't have led to any increase in consumption there.
I don't think it will lead to a substantial or dramatic increase in consumption. I certainly don't want to say zero. Okay? And I think it's very, very plausible that the number of people who occasionally, okay, have a toke is going to go up. I mean, take a standard academic, okay, who hopes someday to be appointed to the Council of Economic Advisors. You don't want to ever have to answer that question about your marijuana use. There is no question about martini use or red wine use. So you just don't consume it if you don't really care about it that much. If it becomes legal, well, then it's not a big deal if someone at a Georgetown cocktail party sees you smoking marijuana. That's what happened to Doug Ginsburg. That's why he didn't get a Supreme Court appointment. Okay? So yes, some people will probably smoke occasionally who don't smoke now. But the odd logic is that the people who really care about consuming it are already consuming it. Okay? And therefore, we're not going to see much change.
So stepping out of the world of logic for just a moment into the world of facts, do we have any
Glad you
evidence?
turned to me when you said that.
Well, don't worry, the shoe will fall in the other direction shortly.
No doubt about it.
So is there any evidence from Colorado and Washington that we now have these dispensaries and consumption of drugs?
Well, there's a couple things. I mean, obviously Colorado and Washington haven't fully implemented. In fact, they haven't really implemented the stores that they're going to have until next year. But actually, looking into Colorado's medical marijuana gives us a hint of what's going to happen, because they passed medical marijuana in 2001, but they didn't have dispensaries, in other words, storefront retail sales with commercialization, which is really what I'm worried about, until about 2006, 2007. And they went from 500 people on the rolls getting medical marijuana to over 108,000. I guess there was a huge epidemic of, fourth stage cancer among 30-year-old white males, because that was the typical person going to these dispensaries. And so what happened, what we have seen is we have seen increases in use in states that have, in that, and we have also seen where we've seen decreases in all driving accidents, for example, motor vehicle accidents, with folks that are testing positive for marijuana. There's been increases, and that isn't the case with any other drug. The issue is you also have the mass commercialization, and you have the fact that you have these edibles, for example, these brownies or other things that no one has any idea what's in it. They're 20 to 30% THC. Actually, there's an article in JAMA Pediatrics from a month ago documenting 7 children under 10 years old who accidentally ingested THC brownies and in fact almost died and had to be sent to the ER. And there are thousands of cases of ER cases since there's been a mass spread of medical marijuana. There have only been a few studies that have looked at medical marijuana in multiple states to see if there's been an increase in use. And really the latest, and I think most reliable, comes from the National Bureau of Economic Research, which also Jeff, I guess, writes for, and Rosalie Pakula and colleagues, finding that they found increases in use in medical marijuana states if those states had 2 characteristics. The 2 characteristics were loose rules on home cultivation and, most notably, dispensaries. So you have a state like New Mexico or a small state on the East Coast that doesn't have dispensaries, but they have a medical marijuana law where, in other words, if you're arrested, you can use it as an affirmative defense. They haven't seen increases in those places. However, in the places like California, Colorado, and others, where there are the storefront retail sales and commercialization, what Rosalie, who's the co-director of the RAND Drug Policy Research Center, found is that there was increases in use. So I think that we know, and again, I have to completely disagree in terms of the facts of prohibition, that if drugs were legal, their price would be significantly lower. And the reason drugs are so expensive relative to their production, remember, crack is like 2 cents to produce a hit of crack. It doesn't sell for 2 cents. It sells for a lot more. Same thing with heroin. And the reason is you have to pay folks for the risks that they're going to be taking to deal with an illicit drug. So good news for the economists in the room. The economics holds in the fact that when something is harder to get and illicit, it is more expensive. And in fact, again, the research that's been done on this, another example is from RAND, is showing that if California had legalized marijuana, that there could be an 80% reduction in price because of multiple factors related to the fact that it would be legal. So prohibition undoubtedly raises the price of illegal drugs. It would normally be much, much cheaper. And what it does is raises access and availability to these drugs. And that's the issue. So again, the liquor lobby and the tobacco lobby know that they have to increase addiction in order to make profit, right? So I always chuckle when I see "enjoy responsibly" on the bottom of the beer ad. Because if everybody enjoyed responsibly like most people do, but if everybody did it, we'd have no alcohol industry. Okay, they do not make money off of people who use moderately. So there's a reason why when you go to Baltimore, there are 8 times as many liquor stores in communities of color that don't have the resources to write a $50,000 check to Betty Ford Treatment, don't have the other social resources. Why are there 8 times as many liquor stores in these communities when, frankly, there should be more in affluent, upper-class white communities that have more money and probably like to drink more? Well, there's a reason. The industry knows to target the most vulnerable. So, I can't imagine that we would think that a drug like methamphetamine or crack cocaine is like a toaster in terms of the impact that it's going to have on society. And again, that doesn't mean overdoing it on incarceration. That doesn't mean not providing treatment first and foremost. Although I'll tell you, if our goal is to legalize, regulate it, and use that tax money to pay for treatment or prevention, good luck. For every dollar that we get in alcohol and tobacco taxes today, it costs society $10 in lost social costs. Okay, so with the highest tobacco taxes in our history right now, is what anybody who smokes knows, it doesn't come close to paying for the health or social costs. Forget about alcohol, where you have an industry that makes sure there's no increase in tax, paying for that. So I don't see how we would be able to pay for anything if we legalized and regulated a drug like methamphetamine, crack, or heroin.
I want to follow up on one of your points there about how prohibition raises the cost. Do we know anything about the price elasticity of demand for these types of drugs? About how is there price sensitivity?
Whoa. No, most definitely we do. And the higher the drug...
Well, we're going to have your collaborator here chime in.
Can I respond to some of the previous?
Sure, absolutely. And then you'll come back to the price elasticity.
I think if you are a careful economist, you should say we don't know anything. Okay? And we certainly don't know the elasticities of the demand for toaster ovens or toothpaste, because there's something called the identification problem. There's a statistical issue that makes it very hard to estimate that for any good, even if you had great data. And of course, we have terrible data on illegal commodities. So do we have guesstimates, educated guesstimates of the elasticities? Yes. They seem to be in the range of, 0 to 1.5. It's a pretty big range.
Sure.
Some studies find that demand is relatively insensitive to the price, okay, and some studies find it's sort of moderately responsive to price, similar to tobacco and alcohol, and some find it's relatively responsive. None of them is statistically compelling. They all make a lot of strong assumptions in order to generate an estimate. So do we really know whether the demand for drugs is more or less elastic to demand for alcohol, tobacco, or all sorts of other goods? I think a reasonable person should say, no, we simply don't know.
Look, we have our experience with tobacco, and less people are smoking now, and in communities and in states where those taxes are higher. So if you're in the South and the taxes are lower, versus when you're in the Northeast and New York City and the taxes are higher, there are less people smoking.
That's answering the question of whether there is any elasticity at all.
Okay.
And I certainly don't think it's plausible to conclude that there's zero elasticity.
Okay. Okay.
One at a time.
It could be a big range, and it makes a difference. Sure. It makes some difference for some aspects of the question, which range it's in. I think we just don't have a very good idea.
All right, I'm going to change the subject here a little bit. We're going to move into some of our international areas. So with the changes in the law that's taking place in Colorado and Washington, the United States government is apparently in violation of 3 international treaties. This puts the United States in a difficult spot, given the fact that the United States has traditionally been a leader internationally in combating illegal drug trafficking and drug abuse at home and abroad. Now, you mentioned this a little bit in your opening remarks. But, for example, I'm going to read you one part of the Single Convention on Narcotic Drugs. Article 49 states, the use of cannabis for other than medical and scientific purposes must be discontinued as soon as possible. So this is a treaty that the United States signed, convinced other nations around the world to sign this treaty. Then we passed domestic legislation, the Controlled Substances Act, to essentially turn this into domestic law. Now, under the Constitution, those laws take precedent over Colorado and Washington's law. So how do we address this? What are we supposed to do about this? And I'll turn to you first, and then we'll move back over to Jeff.
Yeah, I mean, I think it's what I was saying earlier. It definitely puts us in an awkward position, not only drug policy-wise, I think it sort of undermines our international objectives there, but also just foreign policy-wise. Again, when we're talking about going to a Middle Eastern country and having specific targeted strikes, and our rationale is the international treaties and upholding the international laws, it's just very, very difficult to then, say that we're going to disregard some and not regard the other. I wish I could say this is new for America in terms of necessarily choosing the treaties that it wants to enforce, but it's not. I would say that there are over 150 countries, almost every country in the world, that is a signatory to these treaties. I mean, they're not just things on paper. There are a couple of countries now trying to experiment in light of America's more lenient stance. A country like Uruguay that's trying to experiment with something, or Bolivia that wants to remove themselves from the part of the convention that deals with things like coca chewing for traditional purposes. But this would be a very, very, very different position that the U.S. would be in, and I think it's a very difficult one for us to be in.
Well, it's not a position that we're going to be in. Yeah. We're in this position. So you're somebody that serves as a consultant to the United Nations. That is a body of multiple nations. So what are we supposed to do?
As Americans or the United Nations?
Well, from the American policy perspective, what's the solution? What do we say to the UN? What do we say to these other countries in the Southern Cone where these are big issues?
I don't think there are any good answers, and a good thing I don't work for the American government anymore. That wouldn't be a good answer. But I just think it's extremely awkward for us. I don't know what we say other than maybe to try and make some argument that the states of Colorado and Washington really aren't in violation. I just think it doesn't stand up to the giggle test at all. And we know that there is an international body that has an enforcement mechanism, which I don't know if they would use. They've never used it. The INCB, which technically regulates the scientific and medical flow of legal drugs, for example, opiates. So there is some enforcement there. I'm not sure they would do that, but I worry about the other effects in other areas of foreign policy as well.
Thoughts? I would say that, first, I think it's useful to have a little history. The U.S., going back to about 1910, 1915, was the country pushing for the world to adopt drug prohibition for some historical reasons, idiosyncratic reasons. In fact, the U.S. made it a condition of signing the Treaty of Versailles that ended World War I. They would only sign if every other country agreed that it would implement a drug prohibition law. Okay? So the U.S. is the reason that we have these treaties. So then, the situation still is awkward. My view is we should now go back to the UN and say, you know what, we were wrong. These are stupid laws and therefore stupid treaties, so let's rewrite the treaties and take out those language, or let's abrogate the treaties. I don't really want to advocate that we unilaterally just ignore treaties to which we've been signatories. That probably has some bad repercussions in other areas. But we can certainly say we've changed our mind. We don't want to be in these treaties. We've done it in lots of other cases. We should do it on this policy because it's a bad policy that we're foisting on the rest of the world. And some parts of the rest of the world would be reasonably interested. There's, of course, lots of difference of opinion in every country, but some would be reasonably open to legalizing if it weren't for the pressure that the U.S. puts on them by means of holding this treaty and banging it over their heads.
Yeah, I mean, I don't disagree that if you agree that the treaties are bad, we should try and get rid of them. Obviously, that's the mechanism, but I wouldn't say that there are countries that the only thing standing in their way are the international treaties. I mean, Uruguay.
No, because you put words in my mouth. That's not what I said.
Okay.
I said I think there's significant groups within a lot of countries that would like to legalize.
Well, I was on the U.S.
And in the case of, say, Canada, 5-10 years ago, the U.S., they were not going to legalize, but they were going to liberalize their laws more. The U.S. explicitly threatened to punish them under NAFTA, if they did this step of further decriminalizing marijuana. I forget what the exact details.
Right. So listen. So I was on the U.S. delegation to the UN in the last two administrations, and what we saw was basically countries like Uruguay, one or two countries that may have been interested in something like legalizing. I don't think you could even say groups or pockets of countries. And frankly, when you bring it up to
I said
more than one or two countries.
I said constituencies within countries.
Okay, I didn't get that nuance, but the UN matters the country, whether you have to be the majority of the country, and so the majority of one or two countries have been somewhat interested in regarding cannabis. But of course, you're making the argument of all drugs. I think that would be even more of a stretch on the international level. And again, Uruguay, for example, is going forward with a certain version of legalization, also in light of the treaty. So I think it's to be continued in terms of what's going to happen with the international order on this.
Yeah, I mean, so there's precedent for this. During the Bush administration, the United States withdrew from the ABM, the Anti-Ballistic Missile Treaty, and the sky has not fallen. And there are some folks that would argue that that was, in fact, the right policy, and that it's proven greatly beneficial to a variety of programs. So what I'm going to do next is I'm going to sort of lay out for the folks in the audience where U.S. policy is right now in this issue. At the end of August 29th, the Justice Department released a memo that was essentially laid out the policy guidance to federal prosecutors in the various regions and states around the country. And in the new memorandum, the department makes clear that marijuana remains an illegal drug under the Controlled Substances Act. Federal prosecutors will continue to aggressively enforce this statute. To this end, the department identifies 8 enforcement areas that federal prosecutors should prioritize. These include sales to minor, diversion to other states, distribution of other drugs, cultivation on public lands, possession on federal property, violence or use of firearms, the flow of revenue to criminal enterprises, and adverse public health consequences such as drug driving. And here's where it gets really complicated, though, and perhaps our person that served in the government can clarify this for us. Outside of these enforcement priorities, however, the federal government has traditionally relied on state and local authorities to address marijuana activity through enforcement of their own narcotics laws. This guidance continues that policy. A number of federal prosecutors have indicated that the new policy will not change their attempts to vigorously enforce the Controlled Substances Act. What are we supposed to make of this? Seems like a hopeless muddle to me.
Well, I think we have to realize where most enforcement on marijuana is done in the first place, at least for things like possession. I mean, when you're getting to what the commercial enterprises that they're creating in Washington and Colorado, that is a different story, and that's why I think that the memo was a mistake, and I said that. But sort of backing up on the possession side of it, the 99% of marijuana possession, I mean, the vast, vast majority is done on the state and local level anyway. And in fact, if you're wanting to reduce the prison population, you would not be mentioning marijuana once because, trying to find somebody serving state prison time for any amount of the reason that they're there for any amount of marijuana is almost impossible. Unless they were on a probation violation from a previous violent crime. So I think what the memo was saying at the end was, look, we've never, and it's true, I mean, in the Bush administration as well, as in previous administrations, we've never used federal resources to go after low-level, even distributors, let alone users of marijuana. It's just not been a priority. We're going to continue that. I think sort of backing up in the earlier part of the memo when it said that essentially what the Justice Department is saying is right now we're not going to go to court and sue these states under the preemption under the Controlled Substances Act. We reserve that right to do it later, but really what we're going to do to determine whether we are going to do that or not is to look at these 8 areas which you listed. Why I think that's actually problematic is that, first of all, for 2 reasons. One, I mean, in a state like Colorado with their really what I would call de facto marijuana legalization since 2009, since there's been wide open shops, we might agree on that point. We agree, okay. Really, those 8, you can make a very good argument, let's put it this way, that all of those 8 things have already been violated. So, I mean, we know that there's marijuana going to other states that are deriving from dispensaries. We know there are criminal organizations. We know there are firearms. We know that there have been at least some, we might be able to agree with 1 or 2 adverse public health consequences as a result. So those things have already happened. So I found that part of the memo strange. And the second part I find even more disturbing is that I think what this is going to do is give folks the impression that this is a free-for-all. And it will open the floodgates to the mass commercialization and promotion. And the reason I say that is because there's precedent for that. When I was in the administration in 2009, the Department of Justice, with our input, released a memo that's famously now known as the Ogden Memo, very similar memo to this, which essentially said the president is not going to want to go after those with low-level marijuana, but we are going to monitor the situation and really reserve the right to kind of do what we want, but we're not going to go after low level. Well, the result of that was people thinking that it was a complete green light. So that's why you had states like Colorado go from nobody and 0 dispensaries to 536 in a matter of a year. That's why you had, Montana literally went from 0 to like 1,300 after 2009. People were given the impression that the administration wasn't going to look at this. And what's really interesting from that, and I'll conclude, but this is interesting, is that and this is very rare, the Justice Department, with our input, had to release really a follow-up memo in 2011, the first Cole memo, James Cole. And that memo essentially said, whoa, you guys got the wrong impression. Clearly, you thought this was a green light. It's not. In fact, we're going to keep going after you if you are distributing marijuana, even for medical purposes, even under state law. We're not going to go after the cancer patient, but we are going to go after these large distributors. And the legalization advocates sort of cried foul and said, wait a minute, that's not what you said you were going to do. And frankly, the Obama administration has had, and again, I think we'd agree on this too, has been much tougher on medical marijuana enforcement than even the Bush administration, at least in the first term. Frankly, because U.S. attorneys saw the negative effects in the state areas. So what I worry is that this memo now is going to open the floodgate, and in 2 years we're going to say, oh boy, they got the wrong impression again. Well, now there's Medical Marijuana Inc., there's all these companies, and I think trying to use limited resources to close the door on that is going to be really hard. And so, I support the Justice Department, but I think this was a mistake because it's going to give folks the impression that this is a wide open field now.
So I think the administration was in a very difficult spot, given the nature of the federal law and the relation between federal and state laws. And what happened, if the administration had said, the federal law is the law of the land, okay, it preempts, it trumps state law, we're going to come in and aggressively try to prevent the legalization of marijuana in these two states, it would have been going against the views of many of its supporters, of many Democratic voters. It would have been going against the votes in those two states. Okay? It would have also had to undertake, if it was going to be meaningful, significant commitment of resources to try to actually continue, meaningful marijuana prohibition in either of those two states. So that was never an attractive option for lots of reasons. If it had gone sort of the other extreme and said, you know what, they voted, we're just going to not do anything at all in these two states, you can bet your last dollar that the Republicans would have gone berserk and said, how can you possibly just unilaterally decide not to enforce a federal law that's on the books? It's your responsibility to enforce all the laws, even laws that you don't like. Yeah. And they would have had a reasonable position in sort of making that claim. So first thing I would say is the administration had no good choices. They were probably, whatever their true sympathies on the legalization question, the political types were hoping like crazy these laws would not pass because that was just going to make their life difficult. In terms of what they actually did, I certainly agree it's a muddle. I think it's a little misleading to say we've always relied on the states for enforcement. That's certainly true with respect to possession, but for major drug dealers of all sorts of drugs, there was a lot of cooperation between federal and state, or some
low-level dealing, street-level dealing.
So
not
I think that was slightly sort of disingenuous. What is it going to mean? I think it's likely to mean de facto that they rarely intervene in Colorado, just as they don't intervene too often with respect to the medical marijuana laws. All of the medical marijuana provision, of course, is in violation of federal law as well, because it's not been legalized under federal law. They're still being bought, sold, possessed. Those are all violations of federal law. Bush administration and the Obama administration have interfered with medical marijuana, maybe interfere is the wrong word, have tried to interrupt that to some degree, but it hasn't been enormous in most states. It's been only aggressive in a few places. My guess is it will sort of come and go. It will be, erratic. It will fluctuate in these two new states, okay, pending some different president who might have a completely different view. And you might then get a really aggressive reaction to all medical marijuana, or you might get something that's clearly signals the administration, like the first Ogden memo, is not going to intervene at all, and then it'll swing the other way. But it is a mess.
And I would argue that
the only good thing to do is to say the federal law was both unconstitutional and a bad law, even if it had been constitutional, so we should repeal the federal law and then let states do whatever they want.
That would be convenient.
Let me have a follow-up.
Logical and rational and consistent. That's a good thing for laws.
Well, I want to follow up on that. You mentioned in passing that you have a son, and we have children in our household too. And so one of the things we talk to them about is the importance of laws in our system, in our country. So is essentially the inference I should draw from your position, though, is that if we can get enough people together that are willing to violate the law, that we collectively can simply ignore the law?
No, I never advocate that. I always advocate that people obey the law and work to change the laws that they think are unjust. And I think that if we legalize tomorrow, the standard legalization view that everybody who's behind bars on drug charges should just be let out, I think that's wrong. A large fraction of the people who are behind bars on drug charges, first of all, did something else not so nice for which they were incarcerated.
That's exactly right.
Not all of them, but some of them. And even if that's not true, they knowingly broke the laws that existed at the time they did it.
Well,
I don't think it's right to just give them a free pass. Now, when their probation comes up and so on, presumably they would be more lenient than if it happened in a regime where it's still prohibited. But I am absolutely not advocating violating the law. I'm advocating changing the law.
But what about the enforcement of it?
Well, they have no good choices. I don't know what to advise them. The only, the administration, every government has to make decisions about what laws to prioritize. You can't vigorously enforce everything. So if there is some sort of gray area. But that aside, I don't think the government should just say, we like these laws, we don't like these, so we're going to come in and really vigorously enforce, immigration laws, but not drug laws or whatever. That's why libertarian land would be so nice. There'd be so few laws, you really wouldn't have to think about that. It would be much simpler.
Thomas Hobbes wrote about that world. It wasn't pretty in the English Civil War. Do you have, before we move on to some of the questions from our audience, do you have anything, a last remark you'd like to say?
I just think that that we, I think it's very difficult for the administration to say we're going to sort of wait to see if bad things happen, which is what they said for Colorado and Washington, but again, in the same breath, be very concerned about all sorts of state laws that states are passing that violate federal law that happen to go along with their political objectives. I just think it's very difficult to play that game. And I'm not saying, well, what are they supposed, because you could say, well, someone could say, well, what are they supposed to do? We don't have the resources to go after every single person smoking marijuana, and then therefore they're not, enforcing every single federal. Well, obviously you have to be reasonable. And again, they've done studies on, for example, the chances of arrest for every joint smoked in this country is about 1 in 12,000. That's arrest. That's not even incarceration. So clearly, we're all comfortable with the fact. I don't think anybody's saying that everybody smoking a joint needs to be arrested or put in jail, whatever. But when it's such an abrogation, which when it's so blatant, where you're going to have commercial for-profit enterprises, advertising and promoting an illicit drug. I just think that it's very difficult then to say, well, but I don't like what you're doing in this county in North Carolina with voting ID laws. I just think things like that it's very difficult.
So I have a question here from the audience, and if you have a question you'd like to ask, just to catch my eye, and we'll bring a microphone over to you. First question is, in the last 6 years, 50,000 people, plus or minus, in Mexico have been killed in the so-called drug war there. Would legalization eradicate or at least significantly decrease violence in our neighboring states or in Latin America? If this is not the case, what can be done about this drug violence? Would you like to start?
Sure. I mean, I think that that it wouldn't be the case, obviously. But the reason is, first of all, it's clear that these are not drug cartels, actually. They're international, transnational, actually, criminal organizations that are dealing with drugs where they get, yes, no doubt, a lot of their revenue, but they also get a lot of their revenue from things like human trafficking, political extortion, kidnapping, and all sorts of other internet crimes, all sorts of things that we would also have to be okay with, on top of, I think, which is a bit of a stretch, being okay with methamphetamine production and legalization and cocaine and crack and heroin and everything else. If we want to even have a chance at getting at all these revenue streams. So we have to, I think, really, we'd have to go for a lot of that and be okay with a lot of that being legalized. I also think that it's a very myopic view of the issues in Mexico right now to think that that is the way to do this. There's an issue of, yet rule of law, no doubt about it, but also institutional and structural issues that need to be addressed that are, frankly, a lot harder than just, say, legalized drugs. That take a lot more work. I mean, things like an actual operating health system, an actual operating education system, something to give other folks a chance so that they don't have to engage in illicit activities in the first place. So I think, there's a reason why, most people in Mexico, with the carnage of 50,000 and others, are not advocating for the legalization of cocaine and heroin, methamphetamine, because they know that these issues are much more deep-seated. Yes, would legalization take a chunk of the revenue out of these criminal organizations? Of course it would. But I can't imagine that those organizations would then, be fine with that reduced revenue and go on with their day and get into legal activities. I don't think that they are going to go away if we legalize drugs. I think it's much more fundamental.
So I certainly agree that there are many factors which contribute to violence or other kinds of dysfunction in all countries. But I think the evidence is incredibly suggestive that a substantial part, by substantial I'll say 25 to 50%, in a few cases maybe more, of the homicides in producer countries, transit countries, is due to the fact that drugs are prohibited and that those prohibitions are significantly enforced. So to just give one set of facts which is illustrative, of course not by itself compelling, The violence rates in Mexico, while high by US standards, okay, were not super high until approximately 2007-8, when Felipe Calderon became the prime minister, and he dramatically escalated the war on drugs in Mexico. He made it a much, much higher priority than it had been to go after cartels, actively call them out, actively use the military to fight with them. And the amount of violence escalated enormously over a period of a couple years and has stayed fairly high. More broadly, if you look across the various Latin American countries and look at the ones that aggressively try to enforce their prohibitions, you see much higher rates of violence than the countries that don't. U.S. experience with alcohol prohibition is, again, entirely consistent with that. Experience with lots of other goods, prostitution and gambling, et cetera, that have sometimes been prohibited and sometimes not, is also consistent with that. Those industries are violent when they're driven underground, and they're not violent, okay, when they're allowed to be legal industries. Okay? I was recently on a trip to Amsterdam, just coincidence, with my family, with my 19-year-old and my 22-year-old, and we were on one of these tourist barges, and the guide said one of the nice things, interesting things about Amsterdam is that it's very safe and nonviolent, despite having legal drugs and prostitution.
You didn't like that?
My son looked at, well, no, it was a great moment as a father. My 19-year-old looked at me and said, Dad, shouldn't he have said, because of legal drugs and prostitution, Amsterdam is a safe, nonviolent city? All those years of ranting at the dinner table, he was paying a little bit of attention. So, short answer to the question, yes. I think that the prohibitions contribute a lot to violence in many of these countries.
Maybe just one quick
follow-up on that?
Sure. Is, I think it, I also have the view that even if we were to legalize drugs, we are still going to have this underground market that we have now. It wouldn't be as extensive. Now, hold on. You might be thinking, well, we don't have an underground market for alcohol, really. We have a pretty big and growing, in fact, in New York, in places like New York City and others, huge underground market for tobacco in this country, and actually worldwide. In the UK, it comprises 33% of tobacco consumption. It's gray and black markets. In Canada, there's about 20%. In the mining industry, in the legal mining industry, for example, we know that illegal actors are hugely in play in these legal markets. And frankly, if we are to have these reasonable restrictions, Jeff, as you said, for example, potency, age restrictions, what quality product, well, there are going to be people that, yeah, they don't want the 15% THC. They want the 70% that they can use, butane hash oil dabbing in order to get it, and that may not be legal in a place where we're going to do it responsibly. Or people under 21, they're still going to want it as well. And I can't imagine that these underground markets that have spent so long establishing themselves in different cities and places are just going to go away or significantly be reduced. When we have this sort of what legalization proponents call, a tightly regulated, controlled system with age limits and all these other laws around and regulations. Those, unlike alcohol prohibition, where it was only for a decade or so, these guys have been in business for over 50 years, and I just can't imagine they're gonna get up and go home. If we are to legalize drugs, there will be that black market.
Can I respond?
Yeah, sure.
So, first of all, I did not advocate in a legalized world any restrictions on potency. The availability of high-potency products is a benefit to consumers, not a negative. It allows you to consume whatever your desired dose is with minimal amount of whatever negative side effects might be associated with the means of administration. So high tar and nicotine cigarettes would allow smokers to get high nicotine cigarettes would allow smokers to get their nicotine fix with relatively little tar. So if the tobacco companies had been spiking their cigarettes with nicotine, that in fact could be a good thing, not a bad thing. That's exactly what e-cigarettes are. It's letting you get the nicotine without the tar. If marijuana smoking has some negative effects on your lungs, which no evidence supports, by the way, but if it does,
no evidence.
No evidence supports, then if you have a high-potency cigarette, you only need a puff or two to get the dose of intoxication that you want. So I don't advocate restrictions on potency. Likewise, I said modest age restrictions. I totally agree that high age restrictions like 21 or even 18 get you back toward the direction of...
So what would the age restrictions be?
In my world, 0, but I would accept...
So 10-year-olds could get, if they wanted to,
legally,
their parents'
yes.
consent legally could get crack.
Yes, and they do now, under prohibition,
Right.
if they want
Much harder for them to get it than if it was
You
at
don't have any
Walmart.
evidence to support that. Okay,
No
well, let me
evidence
come
to
back to
support
the
that if it's at
underground...
Walmart.
Easy there, Haas.
Okay. the underground markets that you described are cases where some other silly government policy has forced the market underground by excessively high tax rates, or tax rates in one state that are very high on tobacco relative to adjoining tax rate. It's of course guaranteed that that's going to generate gray or black markets as people take advantage of the tax differentials. But in cases where tax rates are moderate, okay, you don't see that. A huge fraction of people apparently find it convenient, okay, and maybe they like the fact that it's law-abiding to buy from a legal supplier. Everybody can grow tomatoes in their backyard, but they all buy the crummy tomatoes you get in the grocery store because it's convenient. So all these people coming from the black market to the medical marijuana market, and I totally agree, many of them are not true patients, they just are recreational users, but they wanted to buy from as legal a source as they could get to. That's also evidence that the black market would go away as long as the regulation and taxation is at most moderate.
I want to come back to something. We're going to move forward a little bit here. Move forward, move sideways. Talk about externalities here, and two types of externalities, and one has to do with the international politics implication of being in violation of these treaties. Now, the Bush administration recognized that the United States was going to be in violation of a treaty, an arms control treaty, and so they withdrew from it. The Obama administration has done nothing of the sort. And one of the concerns I and others have is that we pay significant reputational costs for foisting treaties on others or facilitating the negotiation of treaties and then not living up to our obligations under the treaty there. So I was wondering if either of you could comment about the specific policies of the Obama administration in this regard.
I'll defer to Kevin on that. I just think I've said what I would want to say on that.
Yeah, I mean, no, I think I've said it too. I think that, so if the choices are either, they're both bad choices, I think. I mean, one, deny that there's a violation and defend that, that there isn't, and we're monitoring it and it's still illegal. Remember, in that same memo, in the same breath of the sentence saying we're going to defer prosecution, it says, well, keep in mind, all marijuana use is illegal. We're going to vigorously enforce the Controlled Substances Act. Marijuana is a Schedule I drug. It's illegal. So that has seemed to be the line, I think, that the administration is sticking to, and I think they're going to stick to that internationally versus saying we want to be, upfront and, transparent, and we're going to, remove ourselves from this part of the convention, like Bolivia did with coca, and come back. I think in the administration's mind, if those are the only two choices, that's probably the worst, in a short term, worst for them. To say we're going to remove ourselves from this part and keep ourselves on the other part. I think that has other implications that at short term is not in their interest. I could see why scholars and others who look at the sort of wider view of international law and kind of implications for the U.S. and the costs that you talked about would definitely prefer the the latter view of doing that. But I just don't see that happening.
Okay. We have a question from the audience. Could you identify yourself, please?
Sure. Sorry. My name is Eli Burstein. I'm an undergrad here studying both economics and political science. I was just intrigued that we haven't brought up race yet. I've just, throughout studying here, I've learned that in terms of prohibition, it seems like we're really only prohibiting non-whites from this. From the studies I've seen, whites and blacks use at equal rates, but black incarceration is around like 9-10 times higher. I was just wondering how that factors into your arguments.
That's a great question. Do you want to go first?
Well, I think I did mention it, and I said one of the negative side effects of prohibition, as opposed to just, say, a moderate sin tax, is it makes it much easier for racial profiling to occur. For real crimes, murder, theft, etc., police can, of course, still engage in discriminatory behavior, but there needs to be a body. There needs to be some credible evidence that a TV was stolen or whatever. It's a little bit harder. For drug crime, for victimless crime like that, they say, oh, wearing baggy pants, wearing a hoodie, that's associated with, being a drug user. So they can choose to enforce that in a very discriminatory way. Okay? And I think that's what we see. Making it legal makes it harder for that to occur. So I think that's one huge negative of the war on drugs.
So there's no doubt about it that I think criminal justice policies generally have had a disproportionate impact. And I actually, when you look at other crimes, there are, this is widespread, and it's not just from drugs. What I would say is I think it's very interesting that the leading groups, like the NAACP, do not support legalization, because now I was up with Chris Hayes with the number 2 guy with NAACP, and he said something very interesting. He said, look, Kevin, if the war on drugs is about incarcerating my community, I'm against it. But if the war on drugs is about a public health approach, and about realizing that this is a health issue, then we're all for it. And so I think a lot of those folks, and the reason why frankly, the folks that are behind drug legalization in this country look a lot like more like us than about the populations that you're talking about. Certainly the leadership and where the money is, no doubt about it. I think the reason is you have folks that care about communities of color that have seen the devastation, the public health and justice implications of alcohol legalization and tobacco. And they've seen, like I said earlier, the fact that in most cities in the United States, again, this is not 8 times as many liquor outlets in poor communities of color than in upper class white communities. So the last thing that these folks want introduced is a drug that's easier, and more available to get, especially in a place that does not have the resources. So the reason why blacks and whites use drugs at the same rate, however, addiction rates are higher in minority and poorer communities. Okay, so that's interesting, right? Same use of the drugs, addiction rate higher in other communities, is because there isn't that safety net in a lot of those communities. There isn't adequate health care. There isn't adequate referral to treatment and brief interventions. There isn't adequate physicians identifying early use before it gets to become an actual treatment and addiction problem. So I think it's really interesting to see the fact that those folks are not advocating legalization, but I'm also not advocating mass incarceration. I think one other interesting fact is that, and this was fascinating when I learned about this, as I said, we have 5 times the number in terms of our historical average and also the OECD average of people incarcerated. If we released every drug prisoner today, in other words, the 20% of people, right, our state prisons, 20% of them are there for drug offenses specifically. 20% of those folks and the folks in federal prison. I'm talking traffickers, distributors, the head honcho to the low-level possessor. We wouldn't have 5 times the amount of people incarcerated. We'd have 4 times. We wouldn't have 5 times the amount of OECD average. We'd have 4 times the amount. So yeah, we have an embarrassingly high incarceration problem. Part of the reason is I don't think we have an efficient criminal justice system. People go 25 times through probation, and it's a revolving door, and we don't actually prepare them for their community when they're about to be released. We don't give the job opportunities to folks leaving. And that's why, if you want to look at programs that work, things that are being implemented in some states are things like justice reinvestment, where you actually invest in the people that are about to leave. And the rates of recidivism are significantly lower than when you just let somebody out. So we got to get to those core problems. That's why I think anything that fits on a bumper sticker, whether it's drug war, and you notice I do not use that term, I think it's a horrible term, or whether it's prohibit or incarcerate, or whether it's legalize, let free, 10-year-olds, whatever, I think those are both very, very simplistic solutions to these vastly complex problems. I mean, the idea that less people are going to use drugs if we make them more available, or if we make sure that they go to jail for 30 years, those are both very extreme, I think, and simplistic ways of looking at this extremely complex issue.
We have another question from the audience. We'll have a microphone over to you. You are?
Hi, my name is Sean Wall. I'm a master's in public policy and master's social work student here at the Ford School. I just have a question, a little more domestically minded, but we have a lot of medical backing and a pharmaceutical backing for a lot of drugs like benzodiazepines, opioids, painkillers, a lot of things that have some really harsh side effects, and also have harsh withdrawals, but also lead to increasing use of street drugs when those drugs are removed. So I just was wondering, what, to your knowledge, do you guys believe we should do to handle this? Because to me, I mean, the externalities of those drugs are much harsher than something like marijuana or even alcohol.
So I guess I'm slightly confused.
What would we do about
because
prescription?
The negative effects of these prescription drugs that you mentioned are mainly for the person who's taking the drugs and sort of close family members or friends, perhaps. It's a little bit awkward to consider that an externality, or it is a policy-relevant externality, because if you start wanting to interfere in things that happen within families, there's no good place to stop. Is every time, I mean, we do, and there's some areas where I think everybody would say, yes, spousal abuse. So if you're actually physically hitting your spouse, you don't want to say, oh, that's just between family members. The law clearly intervenes. But do you want to have police in people's houses telling them they have to make their kids do their homework? Do you want, I mean,
right.
So by externalities, as I was using it before, I meant things that are clearly on innocent bystander, driving under the influence and killing innocent pedestrians or other drivers.
Okay, and maybe I misphrased it, but what I meant was, the medical community will prescribe something like Xanax or something like oxycodone or something like that, which will the person will become dependent on, and then it'll be removed when they leave the hospital, when they're stopped doing those things, and they still have a dependence on that, so then they turn to street drugs. I just think it's hypocritical for us to stand here and back these medical communities that are getting people addicted to these drugs through hospitals and through inpatient centers, and then not support things that don't have haven't been proven to be physically addictive.
So first of all, I think the evidence is very consistent that a large fraction of people who take opiates, who take pain medication for medical conditions, stop when they leave the hospital or stop when the painful conditions stop. Of course, in some cases, painful conditions for various illnesses go on for years, decades, lifetimes, so then people keep consuming them because they're still in pain. If you want to call that addiction, you could, but you could also say you're addicted to that the same way you're addicted to food. You need it in order to have a life if the pain is serious. And we probably all have, know people who've been in that situation. Second, if the drugs were legal, they would be available and inexpensive, and the people who wanted to keep using them after they stopped getting them in the hospital could go down to the corner store and purchase them without having to deal with criminals, without having to pay elevated prices. So that problem would be smaller for those people who did acquire some dependence as a result of the medical use.
Well, and I think the problem would be bigger because they would be able to do that. And so the fact that, we've sort of been talking about how drugs only really affect you or your spouse or your family. No, they affect your employer. You're late to work because you're high or you're operating machinery or you're doing something you shouldn't do. Yeah, we can have regulations around it, but good luck if it's cheap, available, and addiction is increased as a result. I mean, you can have all the regulations around that, but you're still going to have problems. I mean, all the regulations around alcohol, for example, and most folks don't know this, cause twice as many arrests in this country for alcohol-related offenses that are non-violent. Okay, I'm talking regulation violations like driving, buying or selling underage, and public drunkenness and intoxication, okay? 2.7 million arrests every year versus 1.6 million arrests for all illegal drugs. So there are also costs and problems when something is more widely available and accessible. And so, I think that whether we're talking the workplace, whether we're talking about driving, there are all sorts of, yes, true externalities as a result of making it easier. Now, that doesn't mean that, I think going to more, what I take from your question is the fact that, yeah, I mean, we want to call it a health issue, but in this country, less than 20% of doctors get like a week of education about addiction. And then they're let free, and then they're meant to write prescriptions for these extremely powerful opiates. I mean, think about a drug like Dilaudid, which I hope none of you ever have to be on. Dilaudid is administered in a hospital. It essentially is heroin. It's just in a synthetic form in a hospital. And so, yeah, those are very powerful substances, and yet physicians are not trained in this country. Frankly, pharmacists are not trained to dispense them. We've had an overprescribing epidemic for the last 10 years, and that's why we have 30,000 people dead from unintentional drug overdoses from prescription drugs, is because of rampant overprescribing of these substances. So I would say let's start with actually the people that are in charge of it, which is physicians, and we should, by the way, have better ways to dispose of medications that don't involve just flushing them down the toilet when you're done with them, because that's also not environmentally sound. We have to do a better job there, too. Again, no easy answers.
So we have a question about, for Jeff here. Last year, somewhere around 30,000 people died in automobile accidents. A significant proportion of those are associated with drunk driving. And we have a pretty good test to measure blood alcohol levels. With marijuana, though, we don't have a good police test. And so one concern some folks have is that absent police officer administrable drug tests, that basically would-be drunk drivers will simply transfer over and use marijuana. And that, in fact, the number of traffic accidents, one of your externalities, is likely to rise. Is that a concern that you have? And if not, why?
It's not a concern, okay, for a couple reasons. So, first of all, I don't think the data suggests that use is going to change very much, as we discussed earlier. And I can explain why I think the things that Kevin said are just completely wrong about the magnitude of the change in use. But for the moment, my assessment is it won't change much, so it won't change the amount of driving under the influence. Second, There's several studies which looked at the possibility that when marijuana becomes closer to legally available or more readily available because of decrim or because of medical marijuana, people substitute from alcohol to marijuana. Not everyone by any stretch, but some people do. On net, there seems to be some substitution direction. And the effects of marijuana in impairing your driving ability seem to be less. They're certainly serious, but they're less than those of alcohol. Particular alcohol, on the influence of alcohol, people tend to drive aggressively. On the influence of marijuana, they seem to drive less aggressively than normal. And so, in fact, these studies found that there were reductions in traffic fatalities associated with the decriminalization of marijuana or with the adoption of medical marijuana laws.
So there's one study that basically looks at 3 states with very modest medical marijuana laws that essentially that did not control for things like anti-drunk driving campaigns and drunk driving laws that found a reduction in drunk driving when there were medical marijuana laws on the books, not even implemented widely through dispensaries, for example, and essentially said, well, there was been a reduction in drunk driving and an increase, and there's medical marijuana, so there's probably the substitution effect. I mean, that is the reading. Well, listen,
that is not
if it's the Daniel Reese study, if it's the Reese study, which is the only study that's looked at this, it is extremely problematic.
There's a study by Chalupka from the mid-1980s.
We'll come back to Mr. Chalupka.
No, that was about substitution. Yes, there are studies about substitution, and frankly, I would argue that on net, actually, it shows complementary. There are studies showing, like the Chalupka study, showing there's a substitution, but on net, I would say actually the studies show that there's complementary, and I wouldn't downplay the negative effects of driving while intoxicated. In fact, the biggest review on this, which was published in the British Medical Journal and epidemiologic reviews, looked at every single study with marijuana and driving and essentially found that intoxication doubled your risk of a car crash because guess what? Driving 30 in a 65, it might just be as dangerous as driving 100 in a 65. And so or stopping before a stop sign 100 feet that's ahead of you because your depth perception is off might be more dangerous than driving 50 miles an hour through the stop sign. So again, this relative, like what's worse, is it this or that? I think is really, really difficult. The driving externality, I think it's very clear that marijuana impairs driving. I think it's very dangerous that a lot of students, when you ask them, say that they've readily gone into cars with people that are high because they've heard that it's not that bad and it makes you a safer driver. Not from you, but maybe from other folks. And I think it's a real problem.
So you completely mischaracterized almost everything that I said. I did not say that driving under the influence of marijuana was not risky.
He's mischaracterizing what I'm saying.
Well, no, you'll have a chance to come back.
I said the evidence suggested that it had a smaller effect in impairing. I didn't say that it wasn't risky to be under the influence of marijuana, which is the way your description made my statement sound. In terms of the studies, I'm aware of the one that you described. I agree, it's a very small-scale study. There's an earlier study about the decriminalization laws, and there's another study that looks much more broadly at a set of medical marijuana laws, and they find what I just summarized. So you weren't giving the full picture of the studies that are out there about the substitution question that I was raising.
Well, they don't find unnecessarily what you're summarizing.
And I think if there's anybody in the room who has ever consumed marijuana and driven on the influence, I think they will tell you they're not driving 30 in a 60 zone under the influence of marijuana.
Well,
that's a gross over-exaggeration.
What I'm talking about are the studies that are showing marijuana impairment is real. So you can.
Yes, I said it was real. I said it was less.
Right.
So
why are you saying it? What's your evidence saying that it's less? Is my point, because by implication you're saying that
a bunch of simulator studies where they took people who experienced alcohol.
Clearly, we're not going to resolve this
disagreement. They had them drive cars in a simulator and measure the rates of accidents. And slow driving and brake response time and a whole set of things done by the U.S. Department of Transportation. That's why I'm saying there's evidence.
And this is the same person that's saying that there's no evidence marijuana hurts your lungs when the American Lung Association and every credible major medical organization says it does. So I just think when you cherry pick studies like that from a point of view from the Cato Institute that is totally contrary to authorities like the AMA and the Lung Association, it's really difficult to take your word about an obscure simulator study from 20 years ago. Sorry.
All right, we're going to stop right here. Not the whole event, but we're going to stop this line of question. We have another question from the audience?
Yeah,
Could you identify yourself, please?
No, I prefer to remain anonymous. If you. No, I'm Mel Levitsky, and I teach a course here in drugs, crime, and terrorism. But I was on the International Narcotics Control Board, so I wanted to correct. I'm not sure if I heard this correctly, but I wanted to correct an impression about the international part of this. in the 3 drug conventions, you can withdraw from the convention. You could give a certain, as we did in ABM. But remember, ABM was a bilateral treaty. This is a multilateral treaty. If you withdraw, you can withdraw from the convention. I doubt the United States would do that, given the fact that we were sponsors of it. It would take a stretch of the imagination to think that we might do that. What Bolivia did was withdraw for the convention because it proposed an amendment that would allow coca chewing. This is a relatively minor part. It applied to maybe 3 countries. So they brought the amendment to the United Nations. All it took was 1 country to oppose it, and believe me, there were a lot of countries that were reluctant to do it, including the United States, did not want to do this to sort of put itself in a singular position. So what happened is they brought it, and then finally the United States and the EU got together, and there was enough cover. 13 countries objected to it. So Bolivia left the convention. They couldn't amend it. Left the convention, and then came back a year later with a reservation on coca chewing, and and nobody's objected to that. Because marijuana is so central to the treaty, to go out and then say, but we're not going to respect the part that relates to marijuana is just not possible, because it would be like getting out of the NPT or signing the NPT and say, okay, well, we signed the NPT, but we're going to develop a bomb anyway because it's central to the treaty. So that becomes really difficult. Now, you could say, well, the United States could undertake a campaign to kind of just abolish these treaties and bring some. I don't think that's very possible. So I just, in the sense of international law, the way this treaty is written makes it very hard for the United States to change international law, since it's a treaty obligation. And so it makes it even more complicated in terms of the federal government saying we're going to allow this in these 2 states. Now, the Netherlands actually bans marijuana. It's been brought before the board several times to try to explain it, and they have a kind of funny position which basically says, well, we've decided we have not changed the law, just like the federal government hasn't changed the law. But we've decided from the standpoint of our population, this is a way to carry out the obligations under the treaty by confining it to so-called coffee houses, that you're supposed to smoke it in the coffee house. And so that's the way they continue to say, well, law hasn't changed. But it sounds kind of funny, doesn't it? Because if you've been to Amsterdam, you know that it's not just smoking coffee houses.
I'm not quite sure I'm following. Are you, sir? I don't think you are arguing that if any country decides it's in a treaty, which it really no longer wants to be in, because it's not, it can get out.
Yeah.
So I agree, it was not like that happened for the U.S. or any other, but we can just withdraw.
There's a way of withdrawing, sure. Every treaty has something that says you give 6-month notice, as they did in the ABM treaty.
So I don't think it's the mechanics. I think it's the substantive question of whether we should want to withdraw. Okay. And I'm trying to convince people that we should want to withdraw.
Okay, but what I'm saying is that it is so unlikely that we have to find that the federal government will continually be in this position of being inconsistent. And so what the question then becomes, should the federal government just say, okay, well, in this case, we're not going to carry out federal law, instead of this strange argument about, well, we'll wait and see if you can, keep it away from kids and this kind of thing.
If you think that prohibition is a good policy, then you presumably think the federal government should continue to try to force the states to help it enforce that policy, and you think we should stay in the treaties. If you think that it's a terrible policy, then the rational thing to do is to try to convince more people that it's a bad policy and we should both abandon it domestically and withdraw from the treaty.
I'm not disputing what you're saying. I'm saying the federal government hasn't taken that position.
I agree.
They haven't said, well, we think legalization is a bad idea, and therefore, we'll leave the treaty. And we'll try to come back in even though we probably can't get it.
In fact, to the contrary, when asked, the president has said multiple times that he's not in favor of legalization. He was just asked 6 months ago, 2 months before this memo was released, that to an addressing young people at a museum in Mexico, that this is not, legalization is not the way his administration wants to go. So it's interesting. Yeah, thank you.
Another question over here?
Thanks. I just had a...
You are?
It's on.
Okay, my name is Courtney Green. I am a student in public policy, a junior undergrad. I I had a question, also just kind of a comment. There was a talk of that legalizing marijuana, with your position here, would not increase the use of marijuana. And I wanted to argue that perhaps it would in a lot of underage students, especially high school age, that wouldn't have had as easy access to it. I know that I was visiting my high school back outside of Boston, and talking to one of my guidance counselors who said, ask him how things are going. He said, it's been really rough with the recent increase in drugs coming into schools, that now as guidance counselors and teachers, we are the ones who have to regulate rather than our local forces or police forces, which, yes, there was this problem before, but now it's coming into schools. So whether or not it's legalized or not, I'm assuming even if we were to legalize it, there would be an age limit. And if that's the case, which probably would be above high school age or just in the middle of high school age, that's bringing it into schools. Even if you say no drugs in schools. And then, there's the drugs, how much is legal, how is not. And so that was, that's just one comment I wanted to bring up because it seemed to be a very big issue to schools and not having the capability or the money to deal with this. That's now going to be their problem.
So my view is that minimum purchase ages for anything are sort of problematic because if they're set at a high age, you can sort of guarantee that a lot of people are going to violate them, as with the 21-year-old drinking age in the US. Anybody who spent any time on any college campus realizes that that's simply a joke. All students know how to get alcohol easily, and all that drinking age does is encourage them to think that laws are for suckers, and that they should ignore parents and figures of authority and all that because they can get away with it. If you have a moderate drinking age, if you have it at 12, it's not going to create much evasion because not very many 11 or 10-year-olds want to consume at all, but it's not going to affect very many people in either direction, so it seems like it's almost sort of silly. Is it possible that as a gentle nudge at, say, 15 or 16, which is what lots of European countries have, it sort of helps keep a few people from trying quite as early? It's possible, but again, it seems likely to be a small effect. But on the question of whether drugs are available, it's legal or illegal, there's questions on the University of Michigan survey of high school students, and they ask them, how easy is it to obtain alcohol, how easy is it to obtain illegal drugs? And the students say that it's at least as easy, the answers imply, at least as easy to get access to illegal drugs as it is to get access to alcohol, even though one is completely illegal and the other is illegal to the 18-year-olds or the 16-year-olds, but legal generally. And it sort of makes sense. If you're the seller of a legal good and there's some minimum purchase age, you face at least a trade-off. You face the cost of violating that it's selling underage, although, of course, you face the benefit because you get more sales. And so if that age is sort of moderate, you can imagine that a lot of the sellers of alcohol will be somewhat incentivized to try to obey it. If the market's completely illegal, then the person who's selling to a 16-year-old is not worried about the fact that he's selling to an underage person. He's worried about getting caught, period. And you have very little effect to nudge people in a right direction. So between the two approaches, I think that having it be overall legal with a moderate minimum purchase age is going to be a little bit better, keeping it away from young kids. But it's clearly going to be highly imperfect. I mean, experience with alcohol, whether it was 18 or 21, makes it very clear. Some kids are going to get access. But making it fully illegal doesn't seem to change that. And if anything, makes it worse.
Again, 7% of people smoke marijuana, 27% smoke use tobacco products, vast majority of cigarettes, and over 55% drink. So whether on a University of Michigan survey, folks say what's easier or not easier, the levels of use show that what's being used and what's not. Actually, I no disrespect to Michigan, a more recent, more precise study that I'm happy to share from Columbia University found that when they asked kids about alcohol, tobacco, prescription drugs, and then marijuana, that marijuana was fourth at that category of 4 in terms of fairly easy and in how long it would take you to find the drug if you had to find it. I think generally those surveys are difficult because it's sort of just like asking somebody, well, do you think you can find, this drug or that drug, and people's perception of what they think they can find versus what they can actually find, I think are difficult. But I think, again, the point is when you look at the use levels, the number is down. And we do know that raising the alcohol drink, even though it's obvious that alcohol is widely available, especially on college campuses for people under 21, study after study has shown how many thousands of lives have been saved by increasing the drinking age from 18 to 21. That there is an effect on some people. And when you have access, availability, and promotion and commercialization, et cetera, that's legally set for at least some kind of higher age limit, there is somewhat of a deterrent effect. And again, when you look at alcohol between 1979 and the users now and drinking, you see a major effect, and multiple studies controlling for other factors have found that. And finally, I would say, I think you bring up a very good point about schools in terms of who's going to who has to hold the bag here. Because one study that we haven't mentioned, which I think is the most significant study in all of drug abuse in the last 25 years, is the most recent finding from the most exhaustive population level study done on substances that we have in our field right now. And that's the Dunedin, New Zealand study that basically looks at everybody born in that city, which is the 4th largest city in New Zealand. Everyone born in the year 1970 and 1971. They've checked in on every single birth, someone who's born, every 5 to 10 years on a whole host of things. And essentially, their big finding from their most recent check-in was that regular persistent marijuana users, those who were using at least 3 to 4 times a week for 3 to 4 years of their adolescence, when controlling for everything else, other drug use, alcohol use, socioeconomic, everything, had an average 8-point reduction in IQ by the time they were 38, even if they had stopped using in adulthood. Now, 8 points takes you from the top third to the bottom third of IQ. When test scores start to be reduced in these states and in this country as we're going towards legalization, as test scores and school academic performance is reduced, who holds the bag on that? Teachers. And that's why teachers are not thrilled about this, because their head is on the table when it comes to kids that are going to have reduced scores. Now, again, that doesn't mean that everybody who uses pot is dumb, and that doesn't mean, I think, the sort of counter, not you, Jeff, but others have said that we all know that a lot of our friends, including a lot of good students who regularly smoke pot, and they're still getting A's and B's. So what is that? No, we do know the vast majority of marijuana smokers do not have problems. That's not the point. It's the small percentage of overall users that have, I would argue, a large amount of the problems. And so, when baby boomers say, well, we smoked pot in college and, we're all lawyers and doctors and we're fine now, that's, first of all, anecdote. That's not based on evidence. And that's, who they know. But they don't know the whole situation. And the marijuana they're smoking is very different. But I think that the school issue is going to be very big. You're going to see schools getting involved in this issue, which they haven't before.
Time for, I think we have our last question here. Get the last word.
That's a lot of pressure.
Yeah. We get a good one.
My name is Craig. I'm a senior here at the Ford School. Thanks for your time, guys. We talked about legalization. We talked about this underground market. And one of the benefits that's been discussed of legalizing is this excess tax, this sin tax that we can put, helping put a little more money in the government where we can put it to education, stuff like that. I guess the point is your weed dealer on the side isn't charging you a tax. So when people still go to the underground markets in order to get cheaper weed? So I guess my concern is there's still probably be an underground market. I guess more towards the Cato argument.
Not if the sin tax is moderate. All the evidence and all the evidence suggests that when markets are legal and the taxes are moderate, I'll come back to what moderate means in a second, people go to the above ground market, not the illegal market. When you go to an above ground market, you're not going to some sort of unsafe part of town. You're not dealing with someone who has chosen to be a criminal by supplying in violation of the law. There's someone you can sue if you didn't get the right quality product, or at least you can hurt that person's reputation by saying such and such a store was a lousy store at which to buy your marijuana. There's all sorts of positive things of dealing with something that's above ground. Okay? And that's why whenever these things become legal, people go to the legal suppliers. It's true for gambling. As it came above ground, people go to the legal gambling. They play the state lottery. They go to all the places that now have casino gambling rather than going to the illegal numbers game because it's preferable. Now, what is moderate? Setting aside differential tax rates across borders, the evidence from alcohol and tobacco across a whole set of countries is that you can have the tax rate be 25, 50% of the price without it being enough to generate a black market. Now, that's not saying that's the price rate at which the tax should be set, But you can have non-trivial tax rates before it seems to create enough of a cost wedge to make people want to go supply it illegal.
Well, I think
Last thoughts.
Yeah, I think with something as easy to produce as marijuana, which is much easier to produce in your backyard than alcohol or tobacco, you are going to have that black market. And so again, when we look at even tobacco today, the gray and black market, the folks that are, recent studies showing that 70% of cigarettes bought in New York City in the Bronx were gray black market cigarettes. And now that might, you could say, well, that's not then they got the tax rate wrong, right? It was too high or whatnot. Well, the point was, weren't we supposed to be paying for all the education and treatment and things that are going to be needed as a result? I mean, you show me a state where the lottery, by the way, and this is how lottery was sold. Remember, the lottery wasn't sold because people like to play games. The lottery initially was sold as the savior to public education. Well, how's that going? Public education safe?
Well, what does that have to do with this question?
That has to do with the fact that we have legalized all sorts of things and said the sin taxes are going to pay for their costs.
So I will agree with you on one.
I think you had your time to talk, and I think it's my time.
I was about to agree with
you. Well, I appreciate that, but I'll take the time to say that with everything that we've done, whether it's the lottery, alcohol, tobacco, et cetera, those taxes do not come close to paying for the cost. Now, we can have an argument about what are the costs of marijuana. They're going to be less than alcohol, which they probably would be, et cetera. But we're also here talking about crack cocaine for 10-year-olds and methamphetamine and heroin. So when we talk about all of those drugs, to think that any kind of moderate tax, so we're not even saying high tax, moderate tax is going to pay for it, I think is something that people are going to delude themselves into thinking, just like they deluded themselves with the lottery.
Thank you both very much for coming. Thank all of you for coming. I hope we'll see you again next semester at our next event.
Thanks so much. Thank you.